contribute something more than they do at low income levels, and the government helps as well. That's a more sustainable model, at least many of these states that were enacting bipartisan reforms found. It's a more sustainable model than either of those two alternatives that were discussed primarily in Washington. And if you combine those kinds of steps with steps to get patients involved and steps to reform payment systems, as I've just described, well, then you're on a path to getting more affordable coverage for everyone. How can you do this with money as tight as I was just describing it earlier this evening, with the budget being as tight as it is in 2009? Well, one place to go is something that both Republicans and Democrats have now put on the table for health insurance reform, and that's for changing the way that our government health insurance subsidy for private employer-provided coverage works. For those of you who have been following this, you know that health insurance, if you get it through your job, is entirely tax excluded. It doesn't count for your income at all. That is actually by far the largest tax expenditure in the federal tax code. A lot of people think the biggest tax expenditure is for the home mortgage deduction. You know, that's something that most people take advantage of, and that's a big deduction. It's worth about $70 billion per year. Do you know how much we spend on the health insurance tax exclusion? If you count federal taxes and Social Security and Medicare tax exclusions, it's about $240 billion. And you know how regressive it is? More money from this exclusion goes to families with incomes over $100,000 than goes to the much larger number of families with incomes under $50,000. So it is not surprising in this era of very tight fiscal concerns and very big concerns about rising health care costs that Republicans and even some Democrats have put on the table reforming this health insurance exclusion, not taking it away from people with employer coverage, but maybe putting a limit on it and using some of the savings to make health care more affordable for people with lower incomes. Combine that with the kinds of reforms that I was just talking about at the state level that have already gotten bipartisan support, and the steps towards paying more for better care and involving patients more in their care through choices that let people save money when they meet their medical needs at a lower cost, and you're well on your way to providing universal coverage and universal health care access that really is to quality, affordable care. Now, none of this is going to be easy, and efforts to find common ground, like the ones that I've talked about, to refocus on value and more targeted, efficient care, are going to be challenging. But I'm optimistic because there is too much at stake. There are too many opportunities coming along for more personalized, more integrated, high-quality health care that can help people live even longer and better lives than we're experiencing today. So I think the fundamentals are good for healthcare delivery system reforms, for real healthcare reforms that move towards patient-centered care, towards this focus on getting much more value, especially if we can help hasten these efforts along through the kinds of healthcare policy reforms that I've just described. I think the time is now to have a new kind of public dialogue about real healthcare reform. We're primed to do it in this presidential election, and we're primed to act on it.